Hi, everybody. I'd like to welcome you to tonight's LionSide chat. Come on in and make sure your audio devices are all ready. And we're going to get started shortly. Okay, everybody. Tonight we would like to welcome you to the LionSide chats. I am Sonia Delacueto, and I'm one of 3 LionSide chat moderators. And I work alongside Dr. Ryan Hassler and Professor Dawn Pfeiffer-Wright. Thank you so much for taking the time to join us. Come on in and welcome to our campus. We're so glad that you could be here. Before we get started, we wanted to share that you should please feel free to submit questions throughout the program via the Q&A feature. We will not be utilizing the raise hand feature or chat this evening. Once our presentation concludes, we will facilitate a discussion with our presenter. We will also be recording today's session so you can revisit the topic or even share the experience with friends and family. So now, in one moment here, we would like to welcome, sorry, a little slow today, Dr. Konak, who is a professor here at Penn State Berks, and he's going to be speaking on simulation modeling of COVID-19 intervention decisions. All right, Dr. Konak, thank you for joining us this evening.
Thank you very much. Thank you for the invitation and organizing this wonderful event.
Absolutely. And you can go ahead and share your screen and start whenever you're ready. Yep.
Okay, thank you.
Yep.
So let me first go to the Okay, hi everyone. Do you see my slide?
We do, it looks great.
Title page?
Yep, it's perfect.
Okay. Hi everyone. Thank you very much for being here tonight, this late time. And I also want to thank our organizers, Sonia, Don, and Ryan Hassler, organizing this event. For us, I think it's a wonderful event, and I think I attend 2 of them so far, and I really enjoy them. And tonight I'm going to talk about a research that I did during May and June with Dr. Shadan Kültürel Konak and a group of students from my intelligent agents and distributed decision-making class, okay, during the summer. So basically, I'm going to show some of the results from our simulation model, and then I will show you some of the results that my students actually got from their term projects. But I just want to emphasize something before starting. So I'm not a real doctor. I'm not a expert on COVID-19. So my area is basically operations research. You could consider that application of math to model and analyze real-life systems. So my focus tonight will be answering this question. How can we use mathematical modeling and particularly simulation models to model spread of COVID-19 and then make predictions and policy decisions based on those models. So that's the framework of my or scope of my presentation today. Okay. Now, I know this is a tough time for everybody, and I think we have to do our best. And I think this kind of events actually provide a little bit color to our life. I hope you guys think the same way. So first, let me briefly summarize my presentation. So I'm going to talk about what is mathematical epidemiology, and I will introduce a little bit history. And then briefly, I will talk about simulation modeling. So what we mean as simulation modeling. And then I will actually get into the details of, how we can actually model, spread of COVID-19 virus, okay? And I will talk about details of the model that we develop without using any mathematics, okay? It will be all visual presentation. And then I will present some results, and then I will discuss some of the results that my students found. And during my presentation, I think feel free to ask questions if you don't understand anything, and I will ask you questions as well. And if it's something is not clear, I think you should let me know right away so I can answer your questions at that point too. Okay, I think I'm ready to start. Okay. So what is mathematical epidemiology? Epidemics have been a part of our history, human history. The Black Death, like Spanish flu, caused millions of deaths, decimating societies and civilizations, okay? So the goal of mathematical epidemiology is to first understand the cause of a disease, okay? How the disease spreads and what is the cause of that disease. Then try to predict the course of that disease so we can make some preparations for that. And finally, try to develop some ways to control it, okay? And then using these mathematical models, we can actually compare alternative scenarios and we can make decisions. Okay. Now, the first mathematical model in epidemiology was attributed to Daniel Bernoulli, actually. The Bernoulli studied smallpox endemic in England and tried to understand whether exposing people to the mild strain of the smallpox virus could extend life expectancy, and it is helpful or not. I mean, though, in 1700s, there wasn't any vaccination, but the idea was, if you expose the people of the children to, weaker strain of the virus, they will have a higher survival rate. Okay, so that was the idea. And his results were actually positive. He published a couple of positive findings on that. And then another interesting study is done by Dr. John Snow. And maybe some of you heard about Dr. John Snow. In 1850s, cholera believed to be spread through smell or bad air in London. Okay, so people didn't have the understanding of the germs those times, and there was a serious outbreak in London. Okay, and it was totally mystery. Nobody understand what was going on. And what Dr. Snow did is, he took the London map and he plotted the number of the deaths on a street map, as you see here in this presentation. And if you can see that there are like so many deaths in this house, and here as well. And then what he realized is, these deaths actually concentrated around water valves. Okay, so you see a pump here, water pump here. So this was one of the application of the data sciences to figure out the cause of a disease and to understand how the disease actually spread out. I mean, if you're a data scientist students, maybe you learn about Dr. Snow experiment or analysis that time. And then let me start my video. I have a short video here. And 1927, late 1920s, two scientists, Kermark and McEndrick, they actually come up with a model that we use today. That model is called susceptible infected and recovery, or SIR model. So in this model, basically the population is assigned three different components or the group. Like most of the population start as susceptibles. These individuals, they are susceptible to the virus, okay? And then they move to the infected states and they stay there during the course of the disease, and then they move to the recovered state. So their contribution was actually great. Okay, so they come up with an equation. In that equation, what when you plug the number of the infected peoples originally in the population, and then another parameter which is called basic reproduction rate, which is actually expected number of new infections from a single infection in the population of susceptible people. So by using these two parameters, we will be able to predict the number of the infected individuals at a given time. So what I did here is I just run a simple simulation of this model, and you can see that, you know, individuals start as susceptible, they get infected, all the time they get recovered, and here you see those, you know, charts which are very similar to the chart that we are used to see, we see on the TV. Okay, so most of the models that we use today based on Carmack and McCarrick's work. And I want to also emphasize another paper. It's not a paper, actually, a report, which was published by a group from Imperial College London. Okay, so in early March, they developed a simulation model based on the SIR model, and they predicted that if there is nothing done, if there is no control of the spread of the virus, there will be 2.2 million deaths in the US. Okay, and this report actually sound alarm bells for politicians. Like in England, for example, after reading this report, Boris Johnson actually applied strict intervention, and also our government also took some actions after reading this report. And since this report published, there has been like thousands of paper published in this area, and it is really amazing how fast scientists study the data and develop new models for COVID-19. Okay. So this is a little bit historical background. So let me discuss a little bit what is a simulation model and how we're going to use this simulation model in this context. So basically, a simulation model is a digital model of a real life system. And what we do is we create that digital model definitely in a computer system. And then our goal is predict its performance in the real world. Okay. So basically, it's an abstraction. Okay. It's an abstraction of reasonable assumptions. And during my presentation, you will see and heard that I will use the term, oh, we assume this, we assume this. As long as those assumptions are reasonable, in simulation models, what we do is we do not actually model the real life system as it is. We make simplifications, we make a lot of assumptions. But as long as our model is close to real life, we can use it for making decisions. So in this particular example, what you see is a simulation model of an emergency clinic. This model will have some input parameters, okay, like number of the nurses, number of incoming patients, number of the doctors, or maybe layout of the facility. And then there will be some output performance metrics, like, you know, waiting line in the queues, or resource utilizations, or utilizations of the facilities. And then by changing the inputs in the digital model, we can predict the outputs, and this help us to design a better and more efficient systems in real life. So this is actually one of my research areas, like developing this simulation models and use them to make predictions to improve the system performance. Okay. Now, so how do we, how do we start developing simulation models? Okay, and like before starting any research, you should ask the questions first. What are the objectives? What we are trying to achieve. Now, in the context of COVID-19 virus, for example, we want to develop a model, to predict how many hospital and intensive care unit beds we need. Okay, we just want to know, number of the ICU beds, for example, to get ready. Okay, so this is called like predictive analysis, because we try to use that model to make some predictions for the future, so we can get ready. Okay, and we can use, for example, another objective could be to make a decision about testing. How frequently we should test individuals. Should we test everybody, or should we test only the people with symptoms? Okay, this is like kind of a policy decision, because you try to identify or come up with an effective policy. Another thing that we can use this type of model is hypothesis testing. Social distancing, these lockdown measures are discussed a lot. So you can ask this question, whether social distancing is effective, whether, shutting down restaurants is effective. So you can test those kind of hypotheses using simulation models. Now, one good way of using simulation models is communication. Okay, so you can tell stories using simulation models, because sometimes, people will not understand the mathematical models, what's going on in those models, but they can really understand visual output of those models. I think simulation models are great for communications. Okay, so in the model that I am going to show you, these are the objectives that we have. So we just want to identify number of the hospital beds. We just want to look at the testing policies, and we want to ask whether the social distancing measures are effective or not. So next question is, okay, in my digital model, what are the things that I need to model? What are the components of that model? I mean, definitely we need to model the individuals, isn't it? We need to model almost each individual in this digital system. So we want to model the relationships and the context between them, definitely. And somehow we have to come up with a way to move those individuals from one state to other state. Like, all the individuals going to be susceptible in the beginning, and they will be infected and they will recover. So we need a way to do that. Okay. And another thing that we need to do is we need to model exposure, how we can say that somebody is going to be infected. And we need to model the testing and quarantine measures and contact tracing maybe in those models. So these are the things that if you write a computer program, thing like that, if you write a computer program, these are the things that you should be doing in that program. And I will show you one by one how to achieve those things in a very simple example. Okay. Now let us start with modeling individuals. Okay, so let us start with modeling individuals and in interactions. So what we are going to do is we are going to use a network. Okay, so basically we're going to have some nodes in that network. So those nodes will represent individuals, and we are going to have links between the nodes, and those links will represent interactions. Okay, I mean, we are familiar with this term, isn't it? Like the social network. In the social network, you are a node, and your friendships, your connections are the link. That's the same concept. Okay, but this link doesn't mean that individuals will actually interact. Okay, so the links represent possibility of interactions. Okay, so for example, individual D in this network can interact with C or F. Okay, now the next question is how are we going to decide those links? Okay, I mean, let's take an example, like Berks Country, and you're an individual and you have those connections, but how are we going to decide that? So you can use like different things for that. For example, you can use distance-based measures. You can assume that everybody within a mile will be assumed, okay, look, I use that term, will be assumed to be connected. So there is a link between them. Or you can say that family members will be connected, okay, close or distant family members. So you can have like all those kind of assumptions, or even you can assume that, they're just randomly connected. Okay, so that depends your assumptions, and I will show you that any of those actually will work in that. So I just want to pause here a little bit. Is there any questions so far? If you guys have any questions,
I don't
please.
see any. None have been submitted yet, but I will definitely alert you, Dr. Koenig.
Okay.
Okay.
So if something is not clear, just let me know. Okay, so we're gonna create this computer program. In that computer program, we are going to create this network with nodes and links between the nodes that representing these interactions. Okay, so the next thing is, okay, let me show you this example. So for example, we can represent a super spreader event using a network like that. If you think about that, in those kind of events, like for example, a game or a political uh, rally, or a gathering, family gathering, there is individuals have this like this very dense connections. That means they interact with a lot of peoples. Okay, so this is like different ways of modeling different scenarios. Okay, now the next thing that we have to model is individuals, a state of the individuals. Okay, so I already discussed this a little bit. So individuals will go through multiple states. So all of them will start as susceptibles. Maybe in the population, we will have one or two infected people, okay? But they will start as susceptible. And in our model, we have a different state. We call it expose. I mean, if you guys remember in the SIR model, we don't have that state, but COVID-19 has like different features. So we just want to model that. So that's the reason we put here another state called expose. And then expose means, you get the virus, but you don't have the symptoms. And most likely you are not infectious yet. Okay, so if you think about number of the viruses in your body or pathogens, after the exposure, it will go up slowly. Okay, and then after some point, you will have uh, enough virus in your body, you start becoming infectious, but you may not have the symptoms yet. Okay, and on the average, it takes like 6 days for COVID-19 patients to develop those symptoms. Okay, so the challenge here is from the modeling perspective. So you exposed and you have the symptoms. You have the 6 days, but these 2-3 days, you are still infectious, but there is no symptoms here. So that's the reason we have this exposed state in our model. We just want to model this stage where you don't have any symptom, but you can infect other people. Okay, and then you start observing the symptoms, and after some point you become infectious again. After some point, I think on the average 14 days, individuals move to the recovered state. So this is how we are going to model like the basic, state of an individual in that network. However, there are two things that we need to discuss here. Approximately 35 and 40% of the COVID-19 patients are not, they don't show any symptoms. So they are asymptomatic, okay? They are still infectious, but they are asymptomatic. And also remember, what was our research objective? Our research objective was to predict, how many hospital beds we need after using this model. So because of that, we make like a couple of changes in the typical model, and we add, another state, like uh, if you are infectious, randomly, you go either the recovered state or the hospitalized state. And if you are hospitalized, again, there is a probability that you may die. Although it is a small probability, we need to consider that in that model. So this is how we actually model, the states of an individual going through the different stages of the disease. Okay. And is there any question?
There is a question.
Yeah.
I'm going to pose it to you. A comment from somebody in the audience is just wondering, is the 35% to 40% asymptomatic exposed? And if yes, is the percentage, is it from a set of survey data? And if from random data, how accurate is 35%? She's wondering how they are identified.
Okay, this is actually, I can share this one at the end of the presentation. CDC actually has a website. That website publishes this kind of data for researchers daily basis. They always update that pages. And we took this data in May, and CDC guidelines says that, in May, and they changed that actually, they increased the percentage to 40% recently. 35% of the individuals with the virus, okay, they have no symptoms. So this data is very accurate. Okay, this is coming from CDC's data, and it is not only for US only, and this is compiled globally. No, this is not a particular state. This data compiled from US, China, India, all other countries. Okay. And I think I'm going to discuss this. This was a very good question. In our model, actually, we can, and it is possible to go that granular. We can use like granular data to set that ratio for individuals depending on where they are located. However, creating those detailed models sometimes is not good. One reason is not good because we don't have like reliable data when the data is very granular, because when you put the data together, you reduce variance. Is that correct? And the second thing is models cannot be scaled. Okay. Okay, I will answer. There is a question. Did we pass the worst part of the COVID-19? We will continue. I think we will discuss this with the results. Is that okay? Later on, this question?
Perfect. Yep. We'll hold on to that one.
Okay. So are we clear about these percentages, where we get those percentages? Okay. So now let us start, modeling the exposure and spread of the virus. And I'm going to take an example and I will go day by day. Okay. And then I will come back and then change my assumptions and then demonstrate that simulation on the network again. Okay, now let's assume that we are in day one and there is one infectious person. Okay, there is one infectious person in our network, and we are in day one. And what we need to do is, now if you look at my network right now, D is going to interact with C and F. So somehow we need to create a way to calculate the probability of individuals being exposed to the virus. Okay. To do so, I'm going to use a mathematical function, but I'm not going to give the details of the mathematical function. Okay. It's actually a very simple mathematical function, but I'm going to use two parameters. Okay. I'm going to say that probability of being exposed to virus is a function of the contact rate, which is how many times an individual interact with an infectious individual. Okay, is that clear? This is the contact rate. So you can have like 10 contacts a day, 20 contacts a day, whatever. And then I'm going to use another rate, okay, which is called infectivity rate. This is what is the percent of those contacts will result in exposure. So if you think about that, not every contact result in exposure, okay? Maybe there is 1% chance, maybe 2% chance that those contacts will result in exposure. Is this two parameters are clear? Okay, so one of them is like how many contacts that individuals are going to make in a day, and then what is the probability that each contact will result in an exposure, or we can call it an infection at the end. Now, here's my assumptions. I'm going to consider the same infectivity rates for all individuals. Okay, I mean, this is a big assumption, you know, but most of the models, they assume that. And we're going to assume the same contact rate for each individual as well. And we will assume that all individuals are equally infectious as well. I mean, you guys see that in the model. I have this like, you know, you think that these assumptions are, I'm trying to simplify the problem, but if you don't simplify it enough, we cannot really work through the model. Okay. Now, is there any question about this? Like how we calculate the probability of being exposed in a day?
Nothing's coming in yet.
Okay.
So I think we're good.
So there was a question about 35% have a variance that might have outliers. Yes, I mean, definitely the numbers that we talk is all averages. Okay. Okay. So let us do some math. Okay, let us do some math, and let's take like different levels of infectivity rate. Okay, like let's consider our infectivity rate is 0.02, 0.01, and then let's consider like different contact rate. So let's say individuals, they make one contact a day. You know, it is obvious if they make one contact a day and the probability is 0.2, this is a probability of getting an infection by contacting an infectious person. It's very small, is that correct? But if you increase your contacts from 1 to 20, then you get like 1/3 chance of being exposed to the virus, or, you know, just basically the virus spreads to a susceptible person. So actually this is a very high probability because we are talking about day one yet, okay? So if you run this in multiple days, and if you have 1/3 probability, eventually you will have a lot of, you know, very high probability of getting infection. So this was day one. So we're gonna move to day two. Oh, before giving day two, let's do some quiz here. So I'm just gonna ask you some questions, okay? So here's my question. So on the left-hand side, I'm giving you some interventions, okay? And wearing masks, social distancing, hand washing. And on the right-hand side, I have the parameters of my model. So the question that I'm asking is, I want you to match each of those interventions with a parameter, only a single parameter of the model such that there's a direct and strong relationship between the intervention and the model parameter. So for example, wearing mask, if people wear mask, it will reduce the infectivity rate or the contact rate. Social distancing will reduce the infectivity rate or the contact rate. So I want you to take a minute or so and think about this. So let's take a minute and let's do this little exercise. And I will sip some tea. Okay, let me show you the answers. You can challenge my answers, okay? So basically wearing mask will reduce the infectivity rate, hand washing as well, social distancing, avoiding crowds, definitely contact rate, closure of non-essential businesses, the contact rate, stay at home, the contact rate. Are we all agree on this? But not the testing. Testing will not affect on any of them, and I will show you why. Again, the contact tracing as well will not affect any of this. Okay. Okay, so there is a comment here. Closure of an essential business reduce the contact rate, definitely, but it will not reduce the infectivity rate, because the infectivity rate is when two persons interact. Okay, let's say one of them is infected. What is the probability that infected person will pass the virus to susceptible person? Okay. But closing the non-essential businesses will definitely reduce the contact rate. Okay. So let me continue. I think I am taking more time than I planned. Okay, so we move to day 2. In day 2 now, if you look at that, let me show you day 1 again. Day 1, we have one infectious person. In day 2, we will have F exposed to the virus. But right now, if you think about that, D is not feeling anything. D is infectious, but no symptoms. F is exposed, no symptoms, nothing else. And let's move to the day 3. C will be exposed. D is still not feeling any symptoms. F is not feeling any symptoms. And in the exposed state, the other nodes or other individuals will not be infected. Okay. And let's move to the day 4. Now, in day 4, let's assume that D observes some symptoms, and D is going to self-quarantine voluntarily. And what is the meaning of that? The meaning of that is if somebody self-quarantine, we don't have those links in the network. So basically, the contact rate becomes 0 for those links. Okay? Now, we will assume that in the model, all symptomatic people will self-quarantine voluntarily. So they are not citizens. If they feel, any kind of symptoms, or if they have if the elevated temperatures or vice versa, whatever, they will self-quarantine. And then that will remove those links from the network. Okay, so this is how we model self-quarantine. Now, however, this is too late. Why it is too late? Because C and F were exposed. Between day 4 and 8, they will actually spread the virus to other individuals in the network. As you see that the virus will spread very quickly. Okay. So this is basically how we write the code for the simulation. So we, day by day, we simulate those events in the computer. So is there any question about this so far? Okay, so I'm gonna move and go back to day 2, but this time I'm going to simulate the same thing considering the testing. So in the first case, I assume that we don't have any testing, okay? Now, we will assume that we test everybody almost every day, let's say, or with some intervals. And day 1, D was not tested. Day 2, D was tested, and then D was positive. Okay. As soon as somebody is tested, and as soon as he or she is uh, positive, we assume that they will be quarantined. Okay. Again, those links are not here. Now, meanwhile, F is already exposed. Even you test F, at the beginning, there is a high probability that the test is not going to catch the virus. Okay, so F will be still have the virus, but no symptoms and will be test negative. Okay, day 3, F is infectious now, and day 4 we test F, let's say positive, but it's too late because the others will be get exposed to the virus. But what you can see here is by testing, we can slow the spread of the virus, but we cannot really stop it quickly, or we cannot stop the spread of the virus enough. We can just slow down it, okay? Now, let's go to another scenario. And in the other scenario, now we have the testing and plus we have the contact tracing. So let's go to the day 2. In day 2, we test D. D was positive. So here, what we're gonna do, we're gonna make sure that D is quarantined. Okay, D cannot communicate or not interact with anyone else, and then we're gonna figure out who are the people, D contacted with, and we're gonna tell them, we're gonna tell C and F, you have to quarantine for 14 days. Even you test negative, no, you need to quarantine. You have to have self-isolation. And if we do that, we knock these links from the network, and you can see that we can actually stop the spread of the virus in this case. Okay, I hope this makes sense how, when we combine the testing with the contact tracing, this is actually more effective way of preventing the spread of the virus. Is that okay? Okay, so let me go to the next slide. So now I'm going to show you our actual model. And what I showed you before was just to, try to explain you how we actually create the code for this COVID-19 model. And then the reason that we developed that model because Berks County Medical Society asked us to write a paper about demonstrating how simulation can be used to inform like COVID-19 prevention measures. Okay, so we just wrote that model in 2 weeks, and we used the data from CDC's COVID-19 pandemic planning scenarios. And I think I mentioned about this. CDC actually published that data regularly so that researchers can go get the data and use them in their models. Okay, so this model was published in their medical record future magazine in June. If you're interested in, I can email you this link. And let me show you the details of that model. Okay, it looks a little bit more complicated, but actually it is the same thing that I discussed. What you see here is you see the state of the individuals that they go through. They start as susceptible, they become exposed. Some of them symptomatic when they get the virus, some of them asymptomatic. And I told you that we need to model, hospitalization. So that my goal was, to figure out how many ICU and hospital beds we need. And we also include like self-quarantining feature here. And the rest of this model basically, connects those states based on the data given by the CDC. Okay, so this is how a COVID-19 model will look like if you open the hood and look at the model like that. And any questions about this model or anything look interesting to you, or if you have any questions, let me answer it before moving with the results. Just look at the model for a while and try to understand what's going on.
Dr. Koenig, another question did pop in.
Yes.
Okay. If my understanding is correct, the percentages are based on probability and assumptions based on existing data. So how is the model validated if the model is correct?
Yes, that's a very good question. Okay, let's take this example. So for example, somebody is exposed, this is like kind of the incubation period, let's say. And after 6 days, incubation period, they either develop symptoms or they don't. And what was the ratio I told you? 35%. So randomly, what we do is 35% of the individuals will be asymptomatic and 65% will be symptomatic. Okay, they will have the symptoms, 65%, 35% will not have the symptoms. And all those ratios here, they come from the CDC. So this is what you do. You run this model, you look at the output, and then you compare the output to historical data and other models. If your result match with the historical data, this is how you actually validate your model. Okay, you can say that, oh, okay, this model is reliable because the patterns that I am predicting actually matches what is happening. The pattern matches actually what's happening in real life. And I will show you an example of that after this. Okay. Now, we have a lot of assumptions here because we really have to do a good validation. Okay, so these are some of the data that we use in this model. And one of the things that I should mention, we assume the testing here. And since we developed this in May, most of the models at time didn't have actually the testing feature. We assume that, for example, tests are correct only 70% of the time or 95% of the time. So we are getting close to the end. So I just want to move to the results, okay? So what we did is, before moving to the result, we simulate a small town. Let's assume that the small town of 10,000 individuals, and we run our simulation for 100 days. Okay, so in that population, only initially 1 or 2% of the population was infected. So here's my question for you. If we increase the testing capacity from 100 to 500, can we slow down the spread of the virus? What do you think? What is your guess? So we have one. Others, any answers? So look at that. I mean, I have like 10,000 individuals and my testing capacity is 500 per day. That means I can like test 20% of that population successfully. It's a quite good number. Okay, let me show you the result, okay? The result depends on number of the contacts, Okay, let us look at here, the blue lines. So here we assume that individuals make 52 contacts per day. And this is a testing capacity, like the dark one is a testing capacity 100, the light one is testing capacity 500. You see that really it doesn't matter how much you increase the testing capacity. Okay, it makes a really little difference here. Now, if you reduce the contact rate to 25, now you start seeing a difference here. Okay, and then if you consider 10 contacts a day, and you really see that we start, flattening that curve by increasing the testing. So what is our conclusion here? Testing enough is not adequate, okay? So there has to be some other measures. We need to really reduce the number of the contacts. Okay. Now let us move to the next question. So the question that we ask, what should be the intensive care unit bed capacity? I don't know you guys know or not, but the capacity, ICU bed capacity is 3 beds per 10,000 person in the US, okay? So this is the overall capacity. I mean, it changes from city to city, but if you look at here with the 22 contacts, we need 45 ICU beds because the infections, spread so fast, the ICU capacity will not be enough. So this is kind of interesting result because in the report that I told you, what they figured out was quite interesting. They said that, if there is nothing controlled, we need like 15 times more ICU bed capacity than the regular ICU bed capacity. So, in the US, this number is 3 on the average. And look at what our model says, 45. So we need to have the 45 capacity for the ICU beds. So this was like kind of interesting because our model actually matched their prediction. So this is one way you can validate a model. Okay, so then we study different cases. Like we said, okay, what if we increase the accuracy of the testing, and then we observe the same pattern. So here, test accuracy is 70%. In this chart, the test accuracy is 95%. That will make a difference. We can really flatten the curve by testing aggressively and with a very accurate test by reducing the contacts. If we don't reduce the contacts, again, it's not going to make any difference. So these are the overall conclusions that we drive. Testing is only effective when it is combined with social distancing measures. Or what we need to do is we need to lower the contact rate and we need to lower the infectivity rate, okay? And although this model was only for demonstration, we observe, very similar patterns to the real life. And then over the summer, my students actually took this model. So I teach a course called Intelligent Agents and Distributed Decision Making. They tweak the model. They study, for example, shutdowns. At what level the government shut down the businesses, at what level they should bring those businesses back. And they also look at the effect of social distancing and wearing masks. And they figure out that if everybody follow the social distancing and they wear masks, those businesses actually, they can stay open for a longer period of time after they reopen. I mean, look at that. There's a shutdown here, the infections goes down, but when you open again, everything goes up. This is what we are having right now, okay? Now, another project, for example, they look at the infections among healthcare providers because at the beginning of the pandemic, we had the shortage of personal protection or PPEs for healthcare providers. This was a big issue. And then they study the effect of that shortage. And their conclusion was, if the healthcare providers have enough equipment, the death rate can be reduced by 1/3. Okay. Again, this was like a simple case study. I wouldn't say that this was like kind of very scientific, but that was the class project's outcome. Okay. So I'm going to conclude my presentation here. You know, conclusion, simulation models can help us to make informed decisions. I mean, if you really need to use them. We can model very complex systems. We have to be careful though, because they depend on the data. If we don't have good data, we will not get good outputs. And I should say that it is very hard to scale them, okay? Because when I run this simulation with 100,000 people, it crashed my computer, then I have to use another programming language, recode everything to run it for 10 million people. But I couldn't go more than 10 million individuals. Okay, so I'm going to stop my presentation here. I took more time than I should.
This is phenomenal. I'm like on the edge of my seat right now. We need to get you on the news to share this information. I don't want to take more time from our audience. We do have a question that's waiting. I'm going to share that with you. We'll probably have time for one or two more after that. So our question here is, do you think that we are past the worst part of COVID-19, or will we continue to get worse and worse? And also, do you think Penn State will shut down from COVID? And at what point do you think they will shut down? In your opinion?
Yes, that's my opinion. It is, you know, it is a very difficult, the second question is very difficult to answer for me. I mean, I think our, you know, administrators, they really work hard to answer those questions. I mean, they think very deeply to answer those questions. You know, they think the students, their education, their health, and faculty's health, and many variables. But in my humble opinion, I think it's not over. If I look at the, you know, I have this curve here. So this is where we are right now. Okay, so we are not still at the highest level, and then the numbers are not going well. You know, the positivity rate is increasing. So the short answer is I don't believe that we are there yet. Okay, we still have a hard time to the peak or the climax of the epidemic. And I'm not sure how long will it take. Okay.
Excellent. Thank you so much. And I like that you shared the research that you assisted your students in facilitating this summer, because I'm, as a parent with school-age children, you know, I would like to apply that business's advice to the schools, because my kids are in school 5 days a week and they're social distancing and wearing masks. So there's so much applicability to this information that you're sharing tonight, and we're just so appreciative.
Well, I should tell you that, you know, after we developed this model, I mean, Shadam worked very hard to collect data for this model, you know, just to make sure we have the accurate data that we can put into the model. So we dug in, you know, we just like, we did like, you know, we really did extreme quarantine, and we're still in that state because we can see how contagious this virus is, and, you know, and the models are not telling us the good stories.
Well, thank you so very much. We don't have any other questions lingering, but you can always feel free, our audience, to please reach out to us, and we will make sure that we get your questions to Dr. Konak. I'm going to actually share just one other slide with everybody as we end up our session today. We would really like to welcome you back to some more of our LionSide chats, and for you to share your information and feedback from today's session, okay? So thank you so much to Dr. Konak for chatting with us today and for sharing how the decision makers really impact our individual and society via these models and the work that you do.
Yeah.
We'd also like to thank everybody for joining us for a LionSide chat. As you click out of the webinar, you're going to receive access to a survey. Please take just a few minutes required to complete the survey to let us know what you thought about today's chat and even offer ideas for some future chats, okay? you're encouraged to reach out to us via email. Our contact information is right there on the screen. And our next chat's coming up on Wednesday, November 4th at 12:15 from Dr. Ike Shibley. He will be hosting our next We Are series installment, We Are Resilient, for our Common Read Week here on campus. So be sure to come back soon, meet with another faculty, staff, or student from Penn State Berks to share their experiences. And we hope that you stay safe, Berks and beyond. And we're signing off until next time. This has been the Penn State Berks LionSide Chats.
Thank you. Thank you for organizing this. And I just want to mention that, if any of the students, I don't know, we have the students, if they're interested in doing, some research on this topic, we can share the code and, we can help them out.
That's awesome. Thank you so much. Like such great work that you're doing. And we're so excited, and we hope to see you back again to share another session soon. Okay.
Good. Thank you.
Thank
Bye-bye.
you. Have a good night, everybody.